Hi, hello everyone. I'm Randy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department. This is Tuesday, first day of the week for most of us, but Tuesday, September 7th. And I'm here to pick up our daily updates of the impacts of the COVID-19 pandemic on Mobile County. So, our daily and weekly expanded reports were both published today. And you will see in those reports that we are continuing to see a decline in the number of COVID cases reported to us. The very low numbers that were reported on Saturday and Sunday and Monday are most certainly due to reductions in testing and people seeking treatment at urgent cares or their doctor's office on a holiday weekend, a 3-day holiday weekend. We always see this effect of Saturday and Sunday and a slight reduction of the number of cases that are diagnosed on the weekend, and that will extend into Monday this week. So we will keep a close eye on if that trend stays low. If you were enjoying college football over the weekend or enjoying activities at local beaches or amusement parks or other venues, you, like I, probably saw lots of people out, thousands, sometimes tens of thousands of people in the stands with no mask on. Fingers crossed that most of them are vaccinated, but I'm not going to bet my house on it. So we're going to be keeping a close eye on how the impacts of football, high school football, college football, going back to school, activities around Labor Day, how that affects the number of cases or the transmission of COVID in our community. We have learned through the last year and a half of the COVID pandemic that every time we have a holiday, we see that followed by a spike in the number of cases that are occurring or spike in COVID transmission within 10 to 14 days of the holiday. So we will keep a close eye on that. Important to know that in the last 2 weeks, 20%, almost 21% of our cases have occurred in children aged 5 to 17, and about 5% of our cases are occurring in 0 to 4-year-olds. So it is definitely, we are seeing a shift toward younger people having COVID, being hospitalized with COVID, and certainly due to the lack of vaccination in those people who are aged 0 to 17. As you know, the vaccine is only approved for those 17 and above. So unfortunately, if you are less than 12 years old, then you really have to rely on your family and wearing a mask and that sort of thing to try to protect you. So we're just seeing most of the cases, or a large majority of the cases, in the very young, and then the other 35%, or overwhelming majority proportion occurring in people aged 25 to 49, and largely in unvaccinated. So again, upwards of 80% of cases, 85, 90% occurring in unvaccinated people. So also a little bit of good news, the number of hospitalizations are continuing to decrease slightly. We still have more people in mobile hospitals with COVID than we had in December and January on any given day, but it is going in the right direction. So happy to see that. So the cumulative number of cases right now is at 65,873. The total number that have died stands at 1,079. 15 new deaths were recorded yesterday. Talk a little bit more about deaths. The cumulative number of hospitalizations over 8,100 now, with 16 new hospitalizations reported yesterday. But again, that is lower than we have seen in some time. So if we look at our expanded report, where we look at the number of COVID cases by week, we can see that the number of cases reported on any given week has gone down for a third week in a row. So that is good news. See, I was looking again at the number and the rate of COVID by age group, and the highest rate of COVID is in people aged 18 to 24, 21 people per 100,000, but the largest number continues to be in the people who are 25 to 49 years old. Another trend that is going down, as I mentioned, the 14-day moving average of people hospitalized in the county is going down. The percent of emergency department visits that are attributable to COVID-like illness is going down. And the number of deaths reported is down slightly, but again, it sometimes takes, death is a lag measure, so it may take another week or two before we hear about deaths that are happening this week or last week. So overall, 37 deaths reported last week, 44 before that. 58 has been the high for our entire pandemic. That was just a couple of weeks ago. So the percent positive laboratory tests is another measure. It's still really high. It's at 22%, and that is still much higher than we would like. If you remember, we were down around 3 to 4% in June. So it will take us some time before we get back to the low levels of transmission, hospitalizations, percent positive, and deaths that we were enjoying in May and June. I wanted just to talk a little bit about sort of nationally. We don't talk about this much anymore, but just wanted to mention that nationally through September 1st, the total number of confirmed and probable cases in the United States was over 39 million cases with 638,000 deaths. And the other number that just blows me away is if you look at the number of people who received at least one dose and then the people who are fully vaccinated, so they probably had another dose, it's around 300 million people. So 300 million people that have taken a very safe and effective vaccine, and we are just hoping that the rest of you will follow suit, because that is the best way that we can try to slow the spread of COVID. Vaccination, and then also layering on wearing a mask and physical distancing yourself from other people, staying at home when you're sick. Just want to remind you about who should get tested for COVID. We haven't visited this in a while, but if you have symptoms of COVID, if you've had close contact with someone who has COVID, even if you're fully vaccinated and you've been around somebody who had COVID, we really would like for you to get tested every 3 to 5 days until your 14-day, sort of traditional quarantine period ends. You don't have to stay at home, but you should wear a mask and get tested every 3 to 5 days. We get, anyone who has symptoms of COVID, regardless of vaccination status, we recommend that you get tested. If you've not been fully vaccinated and you're taking part in activities where you could have put yourself at great risk for exposure to COVID, like going to a football game and not wearing your mask, or if you are traveling, travel is a very high risk activity for transmission. So large social gathering, being in a crowded environment, being in an indoor environment that's poorly ventilated and you're unvaccinated, regardless of symptoms, you should get tested to make sure that if you do have COVID, that you're not spreading it. And then other people who we ask or we refer to testing, really should go. The people who should not get tested for COVID, or people who have tested positive, they should not get tested for 3 months. Again, they're very unlikely to contract COVID a second time, and you should not get tested for at least 3 months after you test positive, because there is a risk that you could be a false positive, and then we're going to tell you to stay at home another 10 days. So that is a little bit tricky. Remember that there are some tests that you can take at home, that you can collect your own specimen and submit that. And the health department is continuing to provide free walk-in COVID tests to anyone who asks for it. You don't have to have symptoms. We don't ask you to supply information about your insurance. There's no copay or fee for that. So come to see us at our locations to get tested, and you can see where we are by going to mchdcares.com. The last thing I'm reading from this 40-page CDC update on COVID. I haven't printed it in a long time, so I decided to print it to take a look. And I did want to mention about the booster shot. So, the FDA has authorized a third dose. So this is a 3-dose primary series for people who are moderately or severely immunocompromised. That has been authorized by the FDA, either Pfizer or Moderna. A third dose in your primary series is recommended if you're moderately or severely immunocompromised. There has been discussion about the possibility of a second series or a booster dose for the rest of us. This is a White House and HHS initiative, and it was announced in the middle of August that perhaps by September 20th, we may see the authorization of a booster dose for everyone who has completed their first series and some time has passed. And all of that's still up in the air because the data are still being reviewed. And really, the primary series of Moderna and Pfizer and Johnson & Johnson are still proving very effective at preventing hospitalizations and deaths, but there may be some decrease in vaccine effectiveness against preventing infection. So again, the vaccine reduces, the ability to transmit it in those who are vaccinated, but that is what it appears, that there's a slight decrease in the vaccine effectiveness against transmission, but it's still highly effective against hospitalizations and deaths. So we'll stay tuned on that. You've probably seen in the national media that the Pfizer vaccine may meet the deadline of getting FDA authorization for a booster dose by the date. None of this has been determined yet for sure, but that Moderna may not be able to meet that deadline. So stay tuned. I was on a CDC call today, and they just have nothing confirmatory to say about if a booster dose is going to be recommended, if it's going to be 1, 2, or 3 products, the timeline for, waiting for that booster dose. So everything is up in the air when it comes to a secondary series or a booster dose. But again, primary series for healthy people, for those with intact immune systems, most of us, is 2 doses of Pfizer, 2 doses of Moderna, or 1 dose of Johnson & Johnson. For people who are moderately or severely immunocompromised, your primary series is 3 doses of Moderna or 3 doses of Pfizer. All right, I might read some more about that later. Let's see. CDC is also publishing studies talking about looking at hospitalizations in children and adolescents since the rise of the Delta variant. So there are questions about, are we seeing increased transmission due to Delta? The answer is yes. Are the large number of hospitalizations and increased number of deaths, are they due to the Delta variant? It looks like that is not what's happening in children. So we have more children with Delta now than we are with COVID now than we had in December and January. But among children, only about 20% of them end up requiring hospitalization, intensive care. So that percentage, about 20% of kids who are hospitalized with COVID-19 will require ICU admission, and that has remained stable. So it doesn't look like that the illness is more severe in children. It's just that we have more kids needing hospitalization because we have more kids with COVID. And again, that due to the Delta variant and children not being eligible for vaccination or having low vaccination rate in young people and in parents. So there was when they looked at hospitalization, hospitalization among ages 0 to 4 saw a 10-fold increase because of the Delta variant, and hospitalizations in unvaccinated 12 to 17-year-olds were 10 times higher than in 12 to 17-year-olds that were fully vaccinated. So again, just demonstrating the importance of getting a vaccine if you're eligible. And then looking at, what does it look like with hospitalization in children and adolescents in states with high vaccination rates compared to those with low. And there was a increase. So hospitalizations in children and adolescents increased 4 times in states with low vaccination rates compared with those with high vaccination rates. So again, protect kids by getting them vaccinated. Protect kids that are not old enough for vaccination by vaccinating your family members and having them wear a mask and physically distance when they're outside of your household. All right, I got a very nasty letter from someone who was not happy with my comments on ivermectin and accused me of being just a worthless doctor. And let me remind everyone that I'm not a medical doctor. I have a doctorate of philosophy in environmental health epidemiology and a Master of Science in biology and forensic science. But I would like to read again from the FDA warning on the use of ivermectin. So let me start by saying, what is ivermectin and how is it used appropriately? So ivermectin tablets are approved by the FDA to treat people with intestinal conditions caused by parasitic worms. There are 2 conditions that are very difficult to pronounce that FDA has approved ivermectin for the treatment of those 2 intestinal parasitic conditions. The FDA has also approved ivermectin in some topical forms, so ones that you would put on your skin, to treat external parasites like head lice and for skin conditions such as rosacea. So those are the FDA-approved uses of ivermectin that are formulated for people, humans. So here is when taking ivermectin can be unsafe. FDA has not authorized or approved ivermectin for treatment or prevention of COVID-19 in people. It has not been shown to be safe or effective. So it's really important that you also remember that animal drugs are often highly concentrated because they're used for large animals like horses and cows. They weigh a lot more than humans. So those high doses can be toxic in humans. So they can give you, if you overdose on ivermectin, and we see them, I think we had 4 in the last month, you can get the overdose of ivermectin by taking an ivermectin formula that's intended for animals can cause nausea, vomiting, diarrhea, hypotension or low blood pressure, allergic reaction like itching or hives, dizziness, ataxia, which means problems with balance, seizures, coma, and even death. So that's straight from the FDA to try to clear the information up that I have recently commented on having to do with ivermectin. All right, one more thing on a recommendation from CDC, and then I will get to the questions. On the August 27th, so just before the Labor Day, before Mark and I left for the Labor Day holiday, MWR published the Prevention and Control of Seasonal Influenza with Vaccines, recommendations of the Advisory Committee on Immunization Practices. And again, flu shots are recommended now. Go ahead and go get one if you have underlying medical conditions, if you're immunosuppressed, if you're young. Please seek a flu shot this year in addition to your COVID shot. And you can take those both at the same time. You don't have to wait 14 days like we used to say. So again, flu shots are going to be very important this year. I think all of the vaccinations are going to be quadrivalent, which means that they are going to have components in there to protect against 4 different influenzas. If you wish to read the 28-page recommendation, you can look for that on the CDC MMWR website. Important thing is go to your pharmacy, go to your doctor, check in at your grocery store pharmacy, check with your workplace to see when you will be able to get an seasonal influenza vaccine. All right, on to some questions. Someone saying one of the the news media saying Mobile County's hospitalizations are about 3 times higher right now than after last Labor Day. Am I concerned about seeing a spike with people traveling over the holiday? Yeah, not just like traveling within Alabama, right? But going to Florida or going, well, probably not going to Texas because of Ida, but or getting on a plane and going to visit people. These are very high risk activities. Travel is one of the highest risks because you are indoors and you are with a mixture of people that you don't know, and there are no requirements for vaccination for traveling. So you don't know if the person they're sitting next to while you're waiting for your flight is vaccinated or not. So yes, I do expect and we're concerned about a spike due to travel. So asking about the Mu variant, MU, also called 626 or 621. It's been detected in, I think, 48 or 49 states in the United States. And, are we concerned about that? I don't know if it's been detected in Mobile yet. It may have been detected in Alabama. I can double check on that. But the important thing is it's still at 0.1% of all of the COVID in the U.S. So it still is an extremely low percent of the COVID that we're seeing, and so far it is not causing any trouble. So that's good news. But yes, this Centers for Disease Control mentioned today and that their work group is going to get together and consider, because I think WHO just named it as a variant of concern internationally. And so CDC will be getting together with their consultants and colleagues to try to determine if they're going to elevate or add the Mu variant to the list of variants of interest or concern for the United States. Again, right now nationally, even though it has been detected, is at an extremely low level and just still being completely outcompeted by Delta. All right. Someone asking about, you may have seen some stories that were running yesterday about some nurses at a Birmingham hospital that were basically protesting or striking for equal pay. And the question is, do I think that we will see this? Nursing shortages and finding enough skilled nurses has been an issue since we saw our first wave of COVID last summer. It's very difficult for hospitals to keep and retain skilled nurses. It's hard for long-term care facilities like nursing homes and assisted living. It's hard for us to keep nurses because, county government doesn't even pay anywhere close to what nurses are paid in long-term care facilities and private doctors' offices and in hospitals. So it is a crisis that we don't have enough nurses out there that we can keep all of our beds and all of our services and everything staffed. It's something we deal with every day. And travel nurses are just getting paid such high hourly wages right now that it's very tempting. I get it, for some young nurses to want to just, to sort of take off and go work as a travel nurse for a couple of months because you can make a lot of money. I saw a comment by Dr. Williamson from the Alabama Hospital Association that they are working with hospitals to help them acquire travel nurses. And I think that the state has reapportioned some CARES money to try to assist Alabama hospitals in getting skilled nurses and keeping them at their facilities, because it is a very difficult situation that our hospitals are dealing with. All right, Facebook questions. Is it still not safe for choirs to sing at church? It is not safe for choirs to sing at church. Singing is a very high-risk activity, particularly when you are indoors because you're not wearing a mask. And when you are singing, respiratory droplets can go much further than the 6 feet barrier that we want you to stay in. I can see them just going out in front of me with these bright lights. So yes, singing, particularly indoor singing, is still a high-risk activity. Someone commenting, I think, not so much a question, but just talking about how difficult it is to, have enough school bus drivers to cover the routes. Again, we've talked about this, or I've talked about it for some time, that decisions about keeping schools open or going to a virtual learning environment, even though we know that kids do better in the classroom, you have to have enough bus drivers, you have to have enough cafeteria workers, you have to have enough teachers. So when you start seeing staff outages because of COVID, either they have COVID or their family members have COVID and they have to stay at home with them, this creates a really challenging situation to try to keep schools open, to keep workplaces open, to keep agencies open. There is no part affected.
Reiterate, we don't have any jurisdictions over openings and closings.
Yeah, Mark's just asking me to remind you all that the health department does not have any regulatory or oversight of schools being opened or closed. That's a decision for the local education authority and superintendents. How close are we to herd immunity? Nowhere close. So we are about 35% fully vaccinated in the county of Mobile, and that's about half where we needed to be. So someone asking about the number hospitalized, where does that number come from? So it comes from the Mobile hospitals. So I'm probably going to miss one. Help me, Mark. Providence Infirmary, Spring Hill, USA University Medical Center, and Children and Women's. Right? So those are the hospitals. Oh, and also Bay Point. Those are the hospitals that they report to the statewide surveillance system or reporting system. It's called the Alabama Instant Management System, and they have been voluntarily, I think at some point the Fed said you shall, but they go in every day and tell us, and then it goes to the state, and then it goes to the feds, information on how many beds are available, how many ICUs, how many people are on mechanical ventilation, if they have staff shortages or PPE shortages. It's all the major hospitals in Mobile. Someone asking, would you mind publishing info on monoclonal antibody shots and how people can get them? So we do have that little graphic that talks about the local hospitals that are doing monoclonal antibody. We probably need to post that again. And then we have heard that some other providers may be starting to, build capacity for monoclonal antibody injections, and that's great news. But in most locations, we're also hearing that it's not like you can't just call someone up and say, hey, I want to come and get, an antibody injection. It's a patient-provider relationship and a patient-provider decision. So it's most of the monoclonal antibody, the intravenous, most of that is done in a hospital setting or an outpatient clinic at a hospital. And then the monoclonal antibody injection, so it's like 4 shots, that can be done more like in a provider office setting, in a doctor's office. Let's see. Okay. Are restaurants supposed to wear masks? So our recommendations are that anyone in an indoor setting should wear a mask, regardless of vaccination status. Everyone.
But is it required now?
It is not required. This just says, are they supposed to? Yeah. There are no mask mandates. If you are, if you're doing everything you can to keep yourself and your family from getting COVID, you need to wear a mask when you're indoors. Someone asking if there's a special test that specifies if you have the Delta variant. Right now, everybody who gets COVID has Delta. There are some special tests that you can do, but they're not routinely ordered, and they're not part of the FDA authorized tests. So I know everybody wants to know, can I get tested for Delta? Everybody who has COVID right now probably has Delta. Someone asking if you can get the flu shot and the COVID at the same time. Yes, you can get them at the same time. All right, someone asking if they had COVID if someone had COVID and recovered, is it okay to be around them? If someone has COVID, they should isolate, stay at home, not be around anybody for 10 days. On the 11th day, it's okay for them to be around people, regardless of vaccination status. All right, I think that's it. Whew, long one today. It's been, I think, 5 or 6 days since we had our Facebook update. So we will be here again tomorrow to give you an update, answer your questions, and address your concerns. Again, put something in our Facebook comment section if it's something really important to you to share or ask. We do our best to answer questions directly and honestly, and I do my best to provide the most accurate information to you that I can. That's my commitment to you as a public servant and as, you know, a member of this community. So we'll keep trying to do that, and we'll see you tomorrow. Have a safe week, everybody. Remember, get vaccinated. Go to mchdcares.org and go get vaccinated tomorrow if you haven't .com. mchdcares.com. And look for a place 7 days a week where you can get a free vaccine and get a free test if you want to. All right, we'll see you tomorrow.